Hello, everyone. So today we are going to discuss our topic patients with HIV, and our presenters are Nuri, Yash, Shadi, Ravleen, and me, myself, Nori. So first of all, I will start with the brief description of HIV. HIV is basically infectious disease that caused by human immunodeficiency virus that basically affects the immune system of human body. It is a globally rising issue for public health because the number of HIV patients are increasing with time. This disease originated in Central Africa from the transmission of virus from chimpanzee to human. It is a symptomatic disease, but it can be asymptomatic and attack immune system very silently. So diagnosis is very crucial for this disease because if it doesn't treat on time, it can lead to a life-threatening situation called AIDS. Next. A lot of research has been done on statistics of HIV patients. The one research I picked for this presentation has been done in Ankara Immune Education and Research Hospital in Turkey, where they have conducted study on 97 HIV positive patients. And it has been reported that out of these 97 HIV positive patients, 72 were males. Mean age of these patients were 36 years. 63% of them belong to low income class. And out of these 97 HIV patients, 27 were females. And out of these females, 84% got infection from their husbands. Next. There are three routes of transmission that were found common in these HIV patients. It is because these patients were having multiple sex partners, intravenous, these patients were intravenous drug abuser, and the patient who got blood transfusion for other conditions. Profession-wise, these patients belong to low-income class, like truck drivers and workers who travel abroad for work purposes. And the reason behind getting the infection is because of their contact with other high-risk population in other parts of the world. Next. And other thing that was very common in these HIV patients was the presence of opportunistic infection, and three infection were very common in these patients were Mycobacterium tuberculosis, Candida albicans, hepatitis B and C. If we look at the report from Centers for Disease Control and Prevention, about 1.7 million new cases were reported globally in 2018. In the same year, another report from CDC about new cases of HIV diagnosis in United States and dependent area, it has been found out that 66% of these patients were gay, 23% were heterosexual, and 6% were injection drug users.
The Public Health Agency of Canada has pointed out 12 determinants of health. A person's health status revolves around these determinants. The World Health Organization states that they are the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. Income and social status. People who live with a lack of quality socioeconomic status are disproportionately affected by HIV. Those with a lower socioeconomic status often have to survive under undesirable conditions. These conditions might impede people from accessing safer sex options, education, safer housing options, as well as quality healthcare. Social support networks. There is a lot of stigma associated with persons with HIV. Imagine feeling toxic and trying to get into social support networks. The feeling of being infectious often leads to people avoiding disclosing one's sexual orientation, sexual activities, and or drug use. This further puts them at a higher risk without having proper support systems to back them up. Education and literacy. Those who are more vulnerable, such as the poor or members of racial and ethnic minorities, are at a high risk of low education and literacy standards. Furthermore, it is essential to improve health literacy among these individuals so as the health of HIV infected individuals could be improved. Employment and working conditions. Stigma and discrimination are the most heavily weighed factors that affect the employment and working conditions of persons affected with HIV. Many individuals are fired solely based on the fact that they are HIV positive. If a sex worker often faces physical and sexual violence. If a sex worker decides to complain against their customers, they're often disregarded due to their occupations. This puts this working condition at a great risk of being disproportionately burdened. Social environments. Due to being highly stigmatized, persons with HIV often feel socially inept. Since HIV is an infectious disease, it is considered dangerous, and therefore people with the virus are often stayed away from. Physical environments. Currently, research is being done on the effects of physical environments on the lives of persons with HIV. However, not enough evidence has been gathered to truly determine the physical factors. Personal health practices and coping skills. According to HIV.gov, the most common mental health condition caused due to HIV is depression. This is mainly due to the society's opinion about HIV. Moreover, moreover, while talking to any healthcare professional about this issue, sexual orientation, sexual activities, and or drug use have to be disclosed. Many people do not feel comfortable doing so as they do not want to be judged. Healthy child development. According to Sick Kids, children infected with HIV can have mild problems such as poor growth or weight gain, skin, chest, ear, or gastrointestinal infections, thrush, enlarged glands, diarrhea, fever, and developmental delay. Since we live in a society where HIV is highly stigmatized, many children are pressured into feeling inadequate because of their infection. Biology and genetic endowment. HIV can only be acquired through sexual intercourse with an infected person, if the blood of an infected person enters into the body of a non infected person, or through breast milk. HIV is not genetically transmissible. Health services. Due to the stigma around the condition, many people tend to not use the resources put out. This puts the person infected with HIV at a higher risk because of the absence of proper health care. Gender. Research says that women are at a higher risk of contracting HIV than men. This is because many women depend on their partners for financial and survival support. Societal norms allow promiscuity among men, but women are to be prudes. This disallows women to talk about sex openly. Not only this, many women are in relationships where they have to behave or abide by their partner's abuse. In these cases, women often have to endure sexual abuse and physical violence. Culture. Culture dictates what kind of sexual behaviors are deemed acceptable, with whom they are acceptable, and when they are acceptable. Not only this, culture also plays an integral part in deciding who, how, and why should safer sex options be used.
Discussing about the HIV related oral conditions, according to American Dental Association, in adults, xeroxtomia is common, which is dryness of mouth. Most of other HIV associated oral conditions are caused by opportunistic infections, which includes candidiasis and histoplasmosis. Opportunistic infections lead to other conditions such as cancer, hairy leukoplakia, and Kaposi's sarcoma. Next, in HIV positive children, salivary gland swelling with xerostomia is common. Oral candidiasis is most common with angular cheilitis and other variants such as erythematous. Like adults, HIV positive children are also vulnerable to opportunistic viral infection, which includes uh, herpes simplex virus, herpes zoster virus, and many more. It has seen that in infected children, there is increased caries prevalence than as compared to normal children. Next, talking about physical, psychological, and developmental risk factor, perinatally infected children faces concerning level of treatment failure and drug resistance. Physically, Physical complications from HIV positive infection and treatment potentially affect all major organ systems of the body. Common developmental abnormalities are bone abnormalities in HIV infected children, which leads to bone fractures and osteoporosis. Throughout childhood, HIV positive tend to have shorter stature and lower body weight as compared to uninfected children. There was a research conducted by NCBI in United States which found higher than expected rates of anxiety, depression, hyperactivity, learning, and other behavior problems, 3 times higher compared to the general pediatric population. Next, ecological factors includes hassle of getting care, negative provider-patient relationships, social attitudes, and funding for care. HIV positive patients are facing hard time to get proper care and counseling, which increase several health related issues. They are constantly facing people of society, which leaves a negative impact on them. Very limited income and high unemployment rates are associated with higher rates of depression and suicidal intention. Moreover, fear of losing benefits, unintended disclosure of HIV status, discrimination concerns, job skill concerns, and many more lead to lack of medical and dental care. Next, talking about identified abilities of HIV positive population, many individuals living with HIV/AIDS have experienced a dramatic turnaround in their health status and their potential for a lifelong with a chronic illness. They have seen it has been seen less functional ability in the positive population as compared to healthy population. There is apathic behavior in activities of daily life.
I'll be discussing the importance of interprofessional practice as it relates to caring for HIV patients and some of the roles that these different professionals play when it comes to HIV patients. When collaborating with different interprofessionals, it helps to improve access to HIV testing, primary care, and predispose or pre-exposure prophylactics. Um, it's also important because it helps patient access, like I said, the primary care, and both of which helps to decrease HIV transmission. And that's according to the University of Michigan because they did a study on that. Next. Now we'll talk about um, who are some of these interprofessionals that play a role in caring for HIV patients. And we can look at social workers. You might ask, okay, what is their role when it comes to dealing with patients with HIV? Now, social workers, they possess the knowledge and skills to work effectively with patients living with HIV and those that are affected by the disease. Could it be a family member? Could it be a partner? And so on and so forth. They also provide education to reduce the incidences of HIV through harmful reduction and population health promotion. Social workers also provide therapy and counseling for concerned patients, such as when it comes to diagnosis and disclosing information. I mean, we all know that there's a stigma when it comes to HIV. Next. Secondly, the role nurses also play in caring for HIV patients. Nurses help to inform patients of available treatment that are available to them. They provide education to the parents and possibly the side effects of the drugs. They provide knowledge on the importance of adherence and scheduling of medication. And lastly, we're going to talk about the role of the pharmacist. The pharmacists, they also do have their own role when it comes to caring for HIV patients, in the sense that they help with screening for managing the drug to drug interactions. They monitor and reinforce the need for strict adherence to taking the drugs, and they also play a role in preventing the development of drug resistance by ensuring selection of potential antiretroviral regime. Next.
So I'm going to talk about the role of dental hygienists with the HIV patients. They play a wider role in recognition of testing and medical conditions such as HIV. They update the medical history every appointment and make sure the lab reports are checked every appointment, especially within if it's been checked from the last 6 months. They check the lab information and record the T cell count and viral load in referral or medical history. Um, Dental hygienists complete all the assessments and risk associated with the provision of dental treatment. They also consider the drug interactions and infections and ability to tolerate the dental treatment. They contact the physician because the drugs associated with the periodontal treatment and the drugs of HIV interact with each other. Dental hygienists also make sure they complete the HIV related questionnaire so they get much information from them. Next. In treating the HIV positive patients, dental hygienists detect the oral manifestations, and if there's any referral needed, they refer them. The main role of HIV positive patients is to detect the oral manifestations, such as they have the oral diseases like oral leukoplakia, Kaposi sarcoma, and they also plan invasive treatments. They focus on preventing infections and the periodontal. They also deal with adverse events during those treatments. The preventive strategies of HIV positive patients are the same as a healthy person. There's a modified care plan, including self care instructions and oral health education. They institute oral preventive protocols. They make sure that they're getting their antiretroviral therapy, which is the HIV medications. And there's also periodic visits for oral screening and periodontal supportive therapy. In HIV positive patients, smoking should be quit because it leads to lung cancer and death. So, dental hygienists always suggest them smoking cessation programs in which there's a support to quit smoking. So, these are our references for our slides, and thank you for listening to us. Have a good day.